Alright guys, so we've successfully created an account, which was the first video. Now we're on to the second video, which I guess is kind of shopping the coverages or better understanding this. So here we go. Need to find your application, take the next steps here if applied with paper. I haven't done that. If you're referred by a state agency, put that in. I haven't done that. Apply for new coverage. Apply and shop for coverage for me and my family. So I'm clicking that. I'm in Louisiana, so it remembered that from when I logged in. And I'm clicking to log in. So this is 1250, which is 150 here on the East Coast, which is where I'm at now in a hotel. So it's 1250 is the time we're starting this process. Verify your identity. Jeez. So here, it's verifying, I guess, my identity. It's asking for pretty much everything. Date of birth, social security number, email address, street address. Sorry, I'm not a really good typer and talker. Trying to get all this together. Okay, so I'm verifying all of my personal information. This is real personal at this point, so I'm assuming they've got a good security system because they've asked me for, stuff that you think you would need I'm not surprised by it. It's just, I'm letting you know where we are in the process. They wanted my social security number, my date of birth. I mean, it's at this point, it's pretty serious. And now it's asking for more clarity. Jeez, it's really getting in here. Okay, it's telling me I'm verified, so we've done that part. That's a big deal. So now we're actually shopping the coverage. Remember, we started at 1:50 Eastern Time. So it's been 3 minutes. We're verified and we're logging in, and I'm extremely proficient with the internet, so it might take some of you all a little longer, but I'm just trying to give you an idea of what this process is like. Now we're starting the application, so it's asking for who is this for, essentially. It's wanting me to agree to terms about privacy. It's doing more confirming of my information. It's asking what's the best way to communicate with me. I guess it's right here. It's just making sure I'm not a robot. So it's making me type stuff in again for confirmation. Okay. It's asking me if anybody's helping me with coverage, and I'm putting no. Uh, Now it's making me like give them permission if somebody was to help me, what would their password be? And I just, or how would they do that? I just went through that. There's a lot of questions here. I mean, this is health coverage, so I get that it's going to be really intimate, but frankly, I'm getting a little exhausted. I'm trying to get to the coverage part, and it's not letting me yet. So we're about 6 minutes in on this part. Now it's asking if I want help with coverage. So if you, I guess this is, for people who are a little lower income and they may want to help paying their health coverage, you could put some data in, and I'm sure they're going to ask for a bunch of information. Okay. Right now I just put that I don't need help paying for the coverage. One, to speed this process up, because it says there'll be fewer questions. I want to get an idea of how this is going. I'm doing coverage just for myself for right now. It's a little redundant. It's asking for stuff that I've already answered. It's asking for my Social Security number again. It's asking if I'm a citizen. It's asking my race. Okay. So now we're at the get insurance part. So it's taking the first part to create an account, which was about 5 minutes, and now it's almost 10 minutes to get to the healthcare coverage part, but it may not be unreasonable. I'm just a little impatient. So it's still, it's inquiring. Like personal kind of questions. So here it's just asking, questions about, previous health coverage, marriage, adoptions, immigration status, stuff like that. It's asking, had I been incarcerated before? Yeah, we're approaching that 10-minute time period. I mean, it seems like it's pretty good. Okay. So I'm agreeing that that they can basically shop me, I guess, for coverage. I think that's what's about to happen. So let's see, results are based on your application, your detailed eligibility results are ready. So I'm clicking view eligibility notes. Notice, and then continue to enrollment. If you confirm your plans between these dates, your coverage will start. Okay. Yeah. So I think right now we're getting into the actual healthcare coverage questions. So I'm going to stop here and go to video number 3 to answer these questions, just so we can make sure this fits properly on social media. All right, give me a sec.